Well, good morning, everyone. Thank you so much for being here. Welcome to February. January was quite the year. There was a lot going on, and there's a lot to catch up on today. We're here to talk about healthcare, but of course, we're happy to talk about issues of the day as well. And thank you for joining us here on a glorious, glorious February day. Nowhere I'd rather be spending my birthday with than all of you here on Treaty 7 territory, where people have been gathering for thousands of years to try and make the community better, as we try to do every single day. And speaking of making the community better, I am thrilled to be joined here by three people who spend their lives making the community better. So Dr. Luanne Metz, the MLA for Calgary Varsity, who I've asked to be the chair of our Commission on the Future of Healthcare. Sarah Hoffman, the MLA for Edmonton-Glenora, and our Shadow Minister for Hospitals and Surgical Facilities. I had to look at that title because I was like, you know, health stuff. Given that there are four of them now. Speaking of four of them, we have here Janet Eremenko, the MLA for the adjoining riding Calgary-Currie, who is our Shadow Minister for Mental Health and Addiction. And as you can imagine from this cast of characters, we want to talk about healthcare. I'll tell you who doesn't want to talk about healthcare. The Premier. I'll tell you who else doesn't want to talk about healthcare. Her four health ministers. I'll tell you who else doesn't want to talk about healthcare. Her Minister of Infrastructure is in charge of building hospital spaces. They want to distract from their dismal record in everything, in healthcare, in public education, on the economy. They'd rather talk about separatism, they'd rather talk about artificial fights, they'd rather swan about the Conservative Convention and talk about how much they love the Constitution, which they don't. But we want to talk about things that are impacting Albertans every single day, whether it's their cost of living, whether it is the state of public education, whether it's the absolutely dismal outlook for jobs for themselves and for their kids, or in particular about healthcare. It's been over a month since we heard the story about someone dying, a young father, dying in the waiting room waiting for care at the Grey Nuns Hospital in Edmonton. Since then, doctors, nurses, frontline workers have bravely spoken out. They've showed us that this tragedy was not just a single event, but a symptom of a healthcare system in crisis. This isn't a normal winter. This isn't because it's the flu season. Every healthcare worker working in an emergency room today will tell you they've never seen anything like this before. And this was not out of the government's control. What we've seen is the results of very specific policy decisions this government has done, favoring chaos over care, favoring corruption over delivering public health services to people who need them. And hundreds of Albertans, if not thousands of Albertans, have been sharing their stories too. They've been sharing it with their MLAs like us, online and in the media, waiting for ambulances that never come, stuck in dangerously long wait times, triaged and cared for in hallways if they're lucky, or in makeshift hospital spaces. And where is the Premier? She hasn't said a word about healthcare. In the last month, we've gotten maybe one and a half updates from the four UCP health ministers and the Minister of Infrastructure to announce nothing new. Not one open critical care bed in the 6 years that the UCP has been in power. Albertans need to see and hear from our Premier. So today, Alberta's New Democrats are demanding that Premier Smith address Albertans, not just to give us lip service or to speak beautifully, but to actually outline the actions she has taken in the last month. What has she done since doctors, patients, and family members have been raising alarms? What specific steps is she taking to fix the healthcare crisis going forward? Can she even acknowledge that it's a crisis? The Premier talks a huge game nationally. Respect jurisdiction. Well, the #1 jurisdiction of the provincial government is healthcare. And this is an area in which she is clearly in charge. She cannot blame the federal government. She cannot blame immigrants. She needs to, for the first time since she's been Premier, take responsibility for something and actually tell Albertans this is what her government has done, and this is what they did wrong, and this is what they're going to fix. Doctors have been calling for a state of emergency, so have we. And we've heard nothing from the UCP. We haven't heard them even acknowledge that this is a crisis. It's clear that there isn't anyone in this government listening until the pressure builds enough for them to respond. So today, we're asking Albertans to speak out, take action and put pressure on the Premier to act. And one way to do that is for Albertans to launch our brand new petition. Any Albertan can sign it, demand that a state of emergency be called, and you can find that at albertahealthcrisis.ca. This petition will be tabled in the legislature, so it's directly in front of all MLAs, helping them understand just how serious and widespread this emergency really is. We'll be sharing all of that on our social channels as well. And we're repeating today our 3 previous calls to action to the Premier, all of which have been ignored. Declare a state of emergency for our hospitals and emergency rooms, install a central command for decision-making so that workers can navigate the chaos created by the UCP and its 11 new health agencies, and recall the legislature early. We're running out of time to do that because we're coming back soon anyway, but we should recall the legislature early to hold an emergency debate on healthcare so that this government can answer to the legislature and we can hold the government to account. The government has to take action. This isn't fun and games. This isn't political point scoring. Albertans' lives are at risk. So I'll turn to my colleagues now to say a few words, and I'll start with Sarah Hoffman.
Thanks so much, Naheed. And as you mentioned, today is his birthday. And when I asked him what he wanted, it's a better government and better health care. And we can all do something today to make that happen. So we have to continue to put pressure on the government because the consequences we know are deadly. As Naheed mentioned, we've launched our petition today, albertahealthcrisis.ca, and I want to encourage everyone to take a few minutes to put their name on that petition. We deserve a premier and ministers that take their jobs seriously. This year's flu season is on track to be the worst and most deadly in Alberta history. The Premier should be encouraging everyone to get vaccinated, and she should be rolling her sleeve up publicly and modeling the same. Almost 1 million Albertans don't have a family doctor. This means that many people have to go to the emergency room, which makes everyone's waits longer. Surgery wait times are unacceptable. That puts everyone's lives at danger. Nurses, doctors, and other healthcare workers are feeling burnt out. I've never seen the healthcare morale lower. We need a workforce strategy and leadership that inspires hope. And last month, we exposed a mouse infestation at an incredibly large long-term care facility. So we need to have clear answers from the Premier and her ministers on what specific actions they are taking to ensure that everyone living in continuing care, especially those who aren't able to advocate for themselves effectively, are safe in their homes. These are just a few examples of issues that the Premier and her health minister should be responding to and showing leadership on, areas where they should be compassionate, confident, and leaders. So now I'll turn things over to our Shadow Minister for Health and Addiction, Mental Health and Addiction, that's Janet Eremenko.
Thank you, Sarah. Keep up the pressure, Alberta, and keep sharing your stories and experiences of what's happening in our healthcare system. This matters because it's only through transparency that we can force action. In my portfolio focused on mental health and addiction, I wanted to highlight a story from last week revealing that up to 89% of ambulance calls for drug overdoses in Calgary were not reported by the government. They've been underreporting what's actually happening on the ground. And why does it matter? Because it means that decisions for resourcing and supporting emergency services are not grounded in reality that we're hearing from the front lines. Mike Parker, the president of the Health Sciences Association of Alberta, the union that represents paramedics and emergency dispatchers in the province, said it best. How do you resource a system when you're not telling the truth about it? This is why we're all here today. What's happening in healthcare is so much worse than what we're being told. We know this, but where is Danielle Smith and her plan to fix it? Join us in the demand to declare a state of emergency in healthcare. You can do it today by visiting albertahealthcrisis.ca to sign the petition. I'll now turn it over to Dr. Luanne Metz.
Thank you, Janet. In my role as chair for the Commission of the Future of Healthcare, I have spent my time consulting widely with experts in healthcare, the people on the front lines who have incredible perseverance and continue to work so hard under very challenging conditions. I can say that the problems we have now can still be fixed. It is possible to ensure that you have access to primary care, that you get emergency care when you need it, and we can make wait lists reasonable. There are known and proven solutions for all of these things, and they all tie together and help each other. We need workforce strategies that consider training, recruitment, retention, and scope of practice. We have heard repeatedly that we can build capacity using measures such as team-based care, by enhancing home care, by implementing preventive measures such as easy access to free COVID vaccines, and by expanding capacity of continuing care and rehabilitation. By working with primary care and specialty services, standardize referral processes coupled with appropriate resources reduce wait times. I've done this before. When I led neurology, we had a wait time at the beginning of 21 months for a routine referral. We brought this down to 4.5 months using these processes. It's not just an IT solution, it's a whole system. We are confident that there are many ways that your care can be improved. Patients know what they want, and experts know how to deliver it. We need the government to listen to what Albertans want and listen to experts on how we can deliver it. We need action right away. And now I'll turn it back to Naheed.
Thanks, Luanne. I'll be quick, to wrap things up. It says, be quick. Here's what we need. We need the Premier to provide an address to Albertans and tell us specifically what she's done on healthcare. We need her to acknowledge that we are in the midst of an emergency and declare it. Healthcare workers need a central command reinstated so that this internal chaos can stop. We need to reconvene the legislature for an emergency debate on healthcare. And we're reaching out to Albertans to ask them to put the pressure on this government by signing the new petition to declare a state of emergency at albertahealthcrisis.ca. albertahealthcrisis.ca. I'll admit to you, it wasn't working on my phone this morning. If it's not, you can simply go to the albertaNDPcaucus.ca and you'll get a link to that as well. But it's time the Premier delivered on her healthcare responsibilities. That's what she was elected to do. She said she'd fix it in 90 days. We've been over 1,000 days and she hasn't. And if this government can't fix this crisis, or if they won't, it's time for a new government that will. So with that, we're happy to answer questions.
All right, everyone, thank you very much. Today, we're going to start with questions in the room. If you have a question that you'd like to ask, please just join me here at the microphone so everybody can hear your question. If you're on Zoom and you want to ask a question, just raise your hand and we'll be taking Zoom questions in just a second. We're going to start with Kevin Green from CTV.
Good morning. My question has to do with safe injection sites and opioid deaths, so I would think it probably is Janet that's going to be taking the stage on this one.
You got 3 people on the stage who know a lot about that, but yes.
Health Canada data shows that across Canada, but mirrored here in Alberta, opioid deaths are dropping and have dropped back down to about the 2019 levels from a peak in 2021 to 2023. Does this, in your mind, show that safe injection sites and harm reduction sites are working, or does this show that there is an opening to reduce or eliminate them because deaths have dropped?
Well, we've now dropped down to the level of what we had when safe injection sites were there. I should call them supervised consumption sites. I don't like using the word safe because they're not. They're safer. Yeah. But I don't want anyone to think that that's the solution to the entire problem. And I'm sure Janet and Sarah know a lot about this and will add more, but I'll just say simply this. It is a great thing that deaths from drug poisoning are going down. But that's happening all over the place, and generally folks say it's for a myriad of reasons. The supply is a little bit less toxic since trade relations changed during the pandemic. Just the precursor drugs are a bit less toxic. There's much wider availability of naloxone. A lot more people are smoking rather than injecting the drugs, which has a completely different risk profile, and a number of other things. But you know, that's something we're seeing all over the place, which is welcome, but it's certainly not anything that is directly related to the Alberta model, the much vaunted but failed Alberta model, that does not take a holistic view on how to keep people alive and help them get better. Janet?
Thanks, Naheed, and thanks for the question. I think I'll just add to that certainly the supervised consumption site here in Calgary and across the province has been a topic of frequent conversation. And I would love for the government to demonstrate the evidence that shows that closure of the supervised consumption site is actually going to address the concerns, the very real and legitimate concerns that people who live in and around the supervised consumption site have around public drug use, around perceptions of social disorder, and around public safety. When folks are able to access the supervised consumption site, it means that they're not using at the public library, they're not using in the city at City Hall, they're not using in stairwells and doorways of businesses. And I have not heard any kind of response from government that actually seeks to address the drug use writ large, let alone what's actually happening in the supervised consumption site. I think all we have to do is look at a story that broke out of Red Deer last week, where firefighters are documenting dramatic increases in their responses to drug toxicity and overdoses since the overdose prevention site closed. And so if we're going to draw a relationship between the existence of supervised consumption sites and drug use in and around it, then we've got to be addressing that rapid emergency response that's been happening. The closure of the overdose prevention site in Red Deer was directly related to increases, dramatic increases from frontline responders to drug overdoses out in the community. And that's exactly what we're trying to avoid here.
As a follow-up, deaths have dropped down to about the 2019 level, which I think is not even arguably. It's still too many people dying from drug overdoses. Yeah. What would your government do if you were in government to try and bring that even lower? Yeah,
it's true. I mean, we're still upwards of 6 people a day that are passing away here in Alberta alone. And 2023 was a absolutely brutal year. It really did peak. I would go back to the data that we spoke about in our initial press release here, where we talk about whether or not we actually have accurate data to make decisions around policy, funding, and programming decisions. If we are dramatically underreporting and failing to fully understand the scope of the issue, we're not going to be able to implement solutions. So that's where we would start. Without a doubt, is let's be fully transparent about EMS calls, firefighter responses through the medical response units, for example, and other agencies and institutions right downtown here in Calgary in particular, so that we can actually get a hold of the problem so that we're not implementing solutions that aren't actually going to fix it.
All right, Kevin, thank you very much. Dane Patterson from CP.
Thanks for taking my questions. So Smith had told Premier Smith had told CTV that she doesn't see the need to police the actions of her caucus when it comes to petitions, and that they can sign whatever petitions they like. I just wanted to know what you make of that.
I really want to know what Peter Guthrie and Scott Sinclair make of that. She has no problem kicking out members of her caucus who dare to ask for a probe into corruption, or members for her caucus who advocate for their own areas in the provincial budget. But being a separatist, that's okay. This is a real big problem. This is the Premier who has learned that according to the organizers of the petition, members of her caucus have signed the separatist petition. These are not people who ran saying I'm an Alberta separatist. They are people who've sworn an oath to be a member of the Legislative Assembly, and yet they won't say who they are. And so last week we called for every UCP MLA to clearly declare where they stand. And look, if you signed the petition, then you're proud to be a separatist. Your caucus mates deserve to know you're a separatist. Your constituents deserve to know you're a separatist. So Premier, if you don't want to police it, that's great, but just don't hide it. And the fact is that she can't police it because she runs a separatist government. And she is trying to play both sides with her garbage word salad of a sovereign Alberta and United Canada, which means nothing, except I want to play both sides. And she's now learning that with her caucus and her government, who are separatist, and her party, who is separatist, she can no longer play both sides. So now she's trying to hide it all. She's trying to attack us. She's trying to distract from her record. And she's trying to hide the fact that she, not the Trudeau Liberals, caused this problem of separatism in this province.
So just as a follow, I'm not sure who'd be best to answer this, but it does seem like the triage liaison physician roles are being held up, and once again it might come down to doctors not liking the pay agreement. The previous rollout of the TLP ended because the funding dried up. Does there need to be a dedicated annual funding to this program, do you think? And what would an agreement need to look like to attract physicians to it?
I'll turn this over to Sarah because she's got a lot of experience in attracting physicians with the right kinds of agreements. I'll just say this, I didn't know until you just said it, that the triage physician program has been delayed. It was supposed to start yesterday. So, you know, what we've heard from a lot of emergency docs is, look, that's fine, but every emergency room doc does triage medicine in the waiting room. You just have to at this point. And the real problem is there just aren't enough of them. So when they first announced this, I thought to myself, how will they create these emergency docs? Where will they come from? And it seems that may be true, but Sarah can say a lot more about this.
Naheed's right. I've spoken to a number of emergency physicians to say, are you going to move into that role? And they said, for what point? If there aren't beds to be able to admit patients into, then it feels to a lot of physicians like this is an exercise in communications and not actually in putting any new resources into the front lines. So, you know, if they can get people to take these roles, that's certainly good news. Number one, in terms of physician agreement, that set this on a really negative path is that we struck an agreement in collaboration with doctors. It was signed, and then the UCP came into government and they tore up the agreement, and then they pushed forward with something totally different than what had actually been agreed to. Obviously, with teachers, we know that they imposed conditions on work, and you can't call it an agreement because nobody voted for it. So it doesn't seem like this government cares really a lot about good labor practices in healthcare or education. And yeah, it's not a shock that people aren't putting their hand up to take a position when there's. It doesn't feel like the government's putting the other tools in place to make the system better. And your question around compensation is a fair one. But most of the doctors I've talked to have said that the bigger issue is around no additional capacity to be able to admit patients to. And if you're triaging people properly, you should be getting them into spaces, into beds where they can be treated. And that doesn't seem to be at all what the UCP is doing.
Sarah, when you were health minister, I
Yeah.
was jumping in here. No, go ahead. I want to ask you to say one other thing.
Sure.
When you were health minister, there was some money in the agreement with the doctors. And tell me what happened to that money. I've heard you say this many times, that they gave it back.
Yeah, so when we reached the final agreement, because we sat down at the table, we were open, we were transparent, we shared data. Physicians absolutely signed a new contract which returned some of the funds that would have been paid out as one-time payments to doctors for retention, because we didn't have an issue attracting and retaining doctors. In fact, in every major municipality in Alberta, you could get a family doctor. There were rural municipalities where now you're seeing close signs on the emergency department. Lac La Biche had the lowest number of patients per doctor of anywhere in the province. So it can absolutely be done if you're respectful, transparent, fair, and working as partners, honoring the expertise that healthcare workers have in helping to find solutions for the system. They will put money back in if they feel like it's actually going to be invested in improving the system. So I think money is a very small piece of the big crisis that we're seeing right now. It is a piece, but the government refusing to stand up, to be accountable, to be transparent with the data, and to take meaningful action, I think is the biggest one. And if we had actually moved forward with building the much needed hospitals we had in Alberta, we would be in a very different situation today.
Okay, on behalf of Tim Brooke from CTV, Kevin's got another question.
Yeah, think of me as Tim. I'm asking on behalf of him. There's a question, I think, for Naheed about the province requiring its employees who are hybrid and remote to return to work. What do you think of the province's edict?
You know, this is yet another example of how the province wants to do a follow me thing, do what other right-wingers are doing without any consultation. You know, Albertans deserve a workforce that is effective, that is efficient, that is providing them great services. And people who work in the public service deserve a boss, a government that is willing to actually talk to them and talk about their concerns, negotiate things that make sense for people. The government did this without really consulting workers. They did it because other people were doing it. They didn't highlight any challenges they were having with productivity. I just don't think that's a very good way to run a big organization.
If you and your caucus were on the other side of the House, would you be requiring employees to return?
Well, sometimes you can't put the ketchup back in the bottle very easily, but what I would simply say is that we would be sitting down with the workers, with their unions, and saying, look, here's some problems we need to solve. Let's come up with some collaborative solutions. And those may well require less hybrid work, but I think we have to be thoughtful and flexible when we're talking with workers about these things.
We're going to go to Zoom now, and our first question comes from Raheem Mohammed from the National Post. Raheem, your microphone's open.
Oh, hang on, Raheem, we can't hear you. There you are. Okay, go ahead.
Happy birthday. I'm sorry I missed you when you were in Ottawa last week. It sounds
I was looking for you everywhere for a cake or something.
No, I just didn't have my stuff together. So I wanted to get your reaction really quickly to a new poll from Ledger that shows that an erosion of some of the gains the NDP made from mid to late 2025. It indicates that the UCP is back up by around 13 points.
Oh, we lost you, Raheem. There you go.
Get my question, or,
I heard you. I didn't hear the very last bit. The last thing I heard was 13 points.
So the new poll from Ledger shows that the UCP is up by about 13 points.
Yeah, so, you know, what politicians always say, polls are good for firefighters, dogs, and fitness enthusiasts. In reality, Raheem, I know you love this stuff, so I will let you know that there have been a number of internal polls over the course of the last little while. The Leger one, shall we say, is a bit of an outlier. But what's interesting to me is what the UCP government's reaction has been to it. If they were really confident that they were so far ahead, the Premier wouldn't have done a series of interviews attacking me on tired old talking points. It's clear that they've seen the other internal polls that show a very different result. That said, it doesn't matter. What really matters is reaching out to Albertans and saying, look, do you think the healthcare system is better since Danielle Smith took power? Is your cost of living gone down? Are you comfortable in your job? Are you confident that your kids are going to have great jobs going forward? How do you feel about the teacher strike, the public education system, the use of the notwithstanding clause? What do you think about the fact that a premier who used the notwithstanding clause 4 times made a speech at the Conservative Convention about how much she loves the Constitution? So there's a lot to be held to account for by this government, and we will continue to hold them to account, and we will continue to prevent them from trying to change the channel. And I think Albertans will be very happy to see that, and I really believe we will form the next government after a campaign.
And rightly or wrongly, do you think the rupture of the Bearspaw South water main around New Year has played into any of the polling numbers, and how comfortable are you campaigning on and defending your 11-year record as Calgary's mayor?
Oh, sure.
In the next provincial election.
Oh, I'm super happy to do that. I'll put my record up against Danielle Smith's record any day of the week and twice on my birthday. Because look, what did we have in Calgary when I was the mayor? We had a city that was ranked the 3rd best city in the world in which to live. We had the lowest residential property taxes in the country. We had incredibly high satisfaction with all services. So it was a great thing. And yes, they're so desperate. They're blaming me for the terrible Flames deal that they signed. They're blaming me for the terrible Green Line that they're funding that costs more than my plan and doesn't get people where they need to go. And they're blaming me for the water rupture when, in fact, the study showed that, well, it completely exonerated me and it completely exonerated all councils. But here's the difference between me and Danielle Smith. She plays a blame game. I'm happy to take responsibility for things that were my faults. And I'm happy to say, look, you know, we had to deal with declining government funding for infrastructure, billions of dollars less for infrastructure. We had to deal with an economic crisis, and we decided that we wanted to hold taxpayers and ratepayers' rates a little bit lower while we were fixing the while we were getting out of the economic crisis. I'm happy to take responsibility for that. Danielle Smith won't take responsibility for anything. So if she wants to put her record up against mine, why don't we do it at the Peter Lougheed Emergency Room tomorrow?
Our next question, and our final question.
I don't think Raheem had a follow-up. Did he have a follow-up?
That was his follow-up.
Oh, okay. Oh, sorry.
Oh, I'm sorry.
No, that's right. He got his follow-up. I'm sorry.
We're going to go next to one more question. Jack Farrell, CP. Thank you.
Oh, you can hear me?
Yeah, there you are, Jack.
Awesome. I just wanted to ask, another thing that Smith told Vashi was, the quote was, as soon as you tell me which caucus members have signed, we can have a conversation. I just don't know that any have signed, so we're talking about a hypothetical situation I don't even know exists.
Okay, hold on a second. Let me just interrupt your question for a minute. So on Thursday, she said, my caucus is united and we all believe in sovereign Alberta within a united Canada. On Friday, she said, I don't care and I can't police who signs it. And now you're telling me she also says, I don't know. Well, you know, I'll let you ask your question in your follow-up, but I just wanted to respond to that by saying, I know where all 38 of my caucus members stand.
Yeah.
It's not really that complicated. In fact, when I introduced the pledge, I realized as I was introducing it that I forgot to tell caucus that they had to sign it. But I also realized that wasn't a problem.
Yeah.
Because they were all going to sign it, because I know who's in my caucus. And I know what values they hold and what they believe in. That's why we're in a caucus together. And if she doesn't even know who her own caucus members are or what they believe in, what the hell kind of premier is she?
Yeah.
All right, to your questions, Jack.
I was just, so when she says that, you know, I just don't know that any have signed, so we're talking about a hypothetical situation, it sounds like she was implying that she would do something about it if a caucus member had signed. Do you think she would?
Well, she said she's not going to police her caucus members, so she's clearly not going to take any action on it. But I'll tell you, we'll make it really, really, really easy for her. Every single MLA's office has been emailed a blank pledge. If they just sign it, then she'll know. Or maybe she could ask them.
Yeah.
Or maybe she could ask them to tell people, because that's the real problem here. If a UCP member is in fact a separatist, well, they're allowed to be a separatist. That's fine. But they certainly didn't tell their constituents that they were a separatist when they were running, or they wouldn't have got the votes they got. And they certainly haven't told their caucus mates, who every single day when we're sitting in the legislature look like they're questioning their life choices because they suddenly find themselves in a separatist government. I think they deserve to know.
Yeah.
I think your team deserves to know. And quite frankly, if I had a member who wasn't willing to sign that pledge, we'd be having a very serious conversation about what they're doing in the New Democrat caucus. Luckily, I don't have to do that because all of our folks were honest when they ran for office and told people who they were and what they stood for. You have a follow-up, Jack?
Nope, that was it. Thank you.
Thank you.
All right, everyone. Thank you very much. That concludes this morning's news conference. Please mind how you go.